Yes, sir, we can start.
So you'll start, or should I start straight away?
You can start straight away with the intro.
Yeah. All right. Good evening, everybody, ladies and gentlemen. All of you, welcome to this webinar that has been organized by Tulsi Trust, Graceful Living. We have with us a very prominent, well-known doctor, Dr. Mazda Turel, who is a neurosurgeon and who is well known in his field of neurosurgery. He specializes in the treatment of diseases of the brain and the spine, and he's also a professor at Grant Medical College and the JJ's group of hospitals. Dr. Turel has completed a fellowship in skull-based surgery and neuro-oncology at the Toronto Western Hospital, and in Shanghai, he specialized in cerebrovascular surgery with specialization in arterial bypass in the brain. Doc, I'm so afraid you'll have to explain all these terms. These are rather complicated terms. The doctor has won accolades for his contribution in the world of medicine. In this talk, he will make a presentation and explain neurosurgery and what it entails. And he will address our seniors on anything they might have regarding brain and spine health. And he will also answer questions raised at the end of the session. So before we start, I'd just like to say thank you and welcome, Doctor. Tulsi Trust and Graceful Living are most obliged for you having come here today. And I'd just like to introduce Tulsi Trust to those people who have not been listening. We are a trust which has been set up by the Chandrai Foundation. And we are specializing in education, medical skills training, and this Graceful Living, which is one of the branches of Tulsi Trust in aging and care for the seniors. So with that, I request Dr. Turel to take over, and I hope all of you have a very interesting session. And please don't hesitate to ask the questions. Thank you.
Hi, good evening, everybody, and thanks once again for taking the time off to listen to this. I hope my screen is visible. You're able to see my presentation?
Yes.
Okay, great. So I'm a neurosurgeon. A neurosurgeon is someone who operates the spine. I'm going to just take you through what neurosurgery entails. I'm going to take you through what neurosurgery entails in general, and giving you an overview of the problems that the aging population should keep in mind, and in some sense take charge of their own health, rather than entirely depending on someone else to tell you what exactly to do. So the brain, if you look at it, an absolutely fascinating and tremendous organ. It is the seat of your consciousness. It is basically divided into four simple lobes: the frontal, parietal, temporal, and occipital. But the beauty of it is that it just weighs about 1.5 kilos, which is about 2% of the body weight, but it consumes about 20% of the body's oxygen demand, and that's the amount of activity that actually goes on in a human brain, and it's the very center of thought, memory, and consciousness. We are what we are because of our brains, and some people have said that it generates more electrical impulses in a single day than all the possible cell phones across the world. So you can imagine the kind of activity that's going on in the human brain. Now, you might find this character a little strange, but this caricature is called the human homunculus, and it is the direct representation of the size of the body parts, of how they are represented on the surface of the brain. One might imagine that the trunk or the torso, which is the biggest part, may have the maximum representations, but parts that require a lot of dexterity. For example, you'll realize that your fingers, which do the maximum amount of your work, and your lips and your tongue, which do the maximum amount of work, they have the maximum representation on the surface of the brain. So if you were to draw out certain parts, and we can map the human brain in especially when we're operating, we know exactly this is the leg area, this is the finger area, this is the hand area, this is the speech, and we stay away from those particular areas. Now, a lot of people, are concerned with being left brain versus right brain, and that theory, I'm not sure is still holds very true. They say that the left-sided people are analytical and rational and thinkers, and they're logical and they're precise, and the right-sided people are more creative and they're more spatial. But it's actually the interaction between the left and the right brain that makes one so individual in their thinking. Now, for example, if you want to know whether you are left-brained or right-brained, you just look at this shoe, and several of you, I know you can't raise hands here, but several of you will look at this color of the shoe as pink and white. And if you can type in your chat box, how many of you see this shoe as pink and white? And how many of you see this shoe as a combination of green and gray? Those people who see the shoe as pink and white will refuse to believe that some people it's more when you do it in an audience where everybody can see the other person giving an opinion. So it's this is how everybody is wired differently and connected differently. And a more deeper meaning to this concept is that no one sees you might not really concur that this is what you're seeing. So this is the beauty of the human brain. So I want to just cover broadly some topics that the elderly especially should be aware of. And one very, very common thing is stroke. A stroke, everyone's heard the term stroke. When you suddenly have a sudden onset weakness of the face, if your face is drooping to one side, or your speech suddenly becomes slurred, or you feel that you have a sudden onset weakness in the fingers, you can't write, you can't hold on to some object, or a coffee cup falls off from your hand, or your speech is slurred, or you have a sudden onset of imbalance, or you have a sudden onset of double vision, you must not wait to call a doctor home and check you out. The only thing you can do at home is probably excuse me, sorry, I have a bit of a cough. Don't mind me. The only thing you can do really is to check your sugar at home, and if there's no hypoglycemia, you should make arrangements, go straight to a hospital, because this is a medical emergency. If there are two types of strokes, one is a stroke that can block a blood stroke that happens when there's a hemorrhage inside the brain, when there's bleeding inside the brain. That can happen in patients who have high blood pressure. The patients who have that can be treated fasting drug that can actually resolve the clot and can improve and you can improve your weakness immediately. So time is of great essence to anybody who has a stroke. Sometimes if you get to the hospital later than 4 to 6 hours, then the deficit, the weakness, the paralysis may be permanent. But if you get to the hospital within the first few hours, it's very, very highly that we may be able to reverse that dysfunction. So please remember that don't waste time thinking about, oh, this will pass. If it passes, let it pass in the hospital. If it, the chance of you recovering, suppose sometimes spontaneously it can recover, but you should not wait for a few hours at home to see if it recovers. You should not, hydrate yourself. You should hydrate yourself, but you shouldn't say that, oh, let me wait for a few hours to see whether this is going to get better, because there's a high chance that you may have missed the bus. Uh, Also, if the clot busting drug doesn't work, we now have the ability to put in catheters inside the brain, and with just a puncture. You don't have to open up the head, and we can withdraw these clots. As you can see, the clot that blocks the blood vessel, which causes the damage. We can remove it, and it's a 10-15 minute procedure, and that can also reverse the neurological deficit. Sometimes we may have to open up the brain to remove the clot, and if this doesn't sound gory to, I'm unable to see reactions of people, but if it doesn't sound too gory, you can look at it. This is how we can open up, cut open a blood vessel inside the brain and physically actually remove that clot and suture the blood vessel back. So that's how much modern neurosurgery is advanced. So that's a little bit about stroke. Something more common that all of us face or have had is headache at some point of time in our lives. Most headaches are migrainous in nature, are tension headaches, are headaches that can be dealt with medication. But the headaches that you want to rule out are headaches which happen because of rupture of a blood vessel, headaches that happen because of an infection in the brain, or headaches that happen because of a brain tumor. Is it possible to put everybody on mute?
हाँ सर लेक्चर चालू है थर्सडे को लेक्चर है तो
Okay, cool. I'm not going too fast.
No, you are on normal pace. You can start.
That's all right. Good. Go ahead.
So
Right.
sometimes headaches can happen because of rupture of blood vessels inside the brain, and if that happens, that again can be treated by surgery or by endovascular means. This you can see is a small aneurysm in the head which has ruptured, and it can be treated again just by putting a puncture in the groin and curing it. This is just a pictorial representation of various kinds of headaches. And I'm sure the last one's going to be everybody's favorite. But when you have a headache, the first thing you should rule out is eye problems, especially if a headache for 2 weeks. It's not going. Get your eyes checked. Make sure you don't have a sinus infection. Make sure you don't have a ear infection. Sometimes jaw disease, as spondylitis or arthritis of the neck, can cause headaches. A lot of elderly people don't know it, but they have what is called as sleep apnea. They snore at night, and that snoring at night can result in excessive daytime sleepiness or headaches during the day. And if that is not checked, and this is something that's completely reversible, completely curable, completely treatable. If that's not checked, then you're going to continue to just pop pills for headache, but not treating the underlying cause. Now, the important thing is that what are sinister headaches or headaches that are bad? Supposing a headache wakes you up in the middle of the night, that's not a good sign at all. You must visit your local doctor and get an MRI of the brain. If your headache is associated with vomiting or double vision, you have to get an MRI. If the headache is associated with some kind of weakness of one side of the body, you have to get an MRI, because you have to also realize that all brain tumors, they don't present or they don't cause all these drastic symptoms. You may just have a dull aching headache for a couple of weeks, and you may still have every year I see at least a handful of patients who've just had a headache. That headache has been ignored. No one's done anything. They've come to me. I've asked for an MRI, and you see a brain tumor. Sometimes these are in nature, and sometimes they are malignant. So the sooner you get them, the easier it is to deal with them. So, this is a good mnemonic to remember for ourselves. If you have headaches that are associated with any kind of fever or weight loss, you should get an MRI of the brain. If you have a headache associated with any difficulty in walking, double vision, weakness of one side of the body, get an MRI of the brain. If your headache is sudden, if you've never had headaches before and suddenly you have a sudden onset headache, which is like the worst headache of your life, get an MRI done. If for the first time in your life, if you have headaches after the age of 50, you've never had headaches before, and you start getting some kind of dull aching headache, which is not going in a couple of weeks, get an MRI done. So, and if your headache continues to get worse despite any medication, get an MRI done. I know it sounds boring, but if that is, if there's one take-home message that you can take from this talk, is that don't hesitate to get an imaging done. If the MRI is normal, it's fine. But if the MRI shows something, you can treat it. Right? So, for example, just look at this young guy. All he complained was of headaches, on and off headaches for the last couple of weeks, and just ignored it, didn't do anything about it. The body is giving you a sign. The body is giving you a story. It's telling you, listen, there's something going on, do something. When you actually check him very, very subtly, you can see, if you check him for 30 seconds, you can see his left hand seems to be slightly weaker than the right, and it's falling. And you can see such a big tumor. You can see this white blob sitting in the center of his brain, smack in his hand and leg area, which is responsible for his weakness. And we can do these kind of sophisticated surgeries with the help of putting electrodes and checking for hand and leg function while we are operating. We have a neurophysiologist in the operation theater, and this is us operating in the operation theater and removing these tumors completely. And you can see just few hours after surgery, his hand function has improved dramatically. Discharged home in a couple of days. And you could see on the pre-op scan that there's such a big blob of tumor and post size this completely. We're even now talking about, when I trained in Canada, we used to do these surgeries as outpatient surgeries. Patients used to come to the hospital in the morning, get their brain tumor removed, and go back home in the evening. Whether this is logistically feasible in our country is a matter of debate. It's all possible now because, now we have very, very sophisticated equipment to check hand and leg areas of the brain on an MRI. You can do something called as a functional MRI, and you can ask a patient to move their hand during an MRI, and the hand area of the brain will light up. You can ask them to move their leg, and the leg area of the brain will light up. And then, see, this tumor here is smack between the hand area and the leg area. This area close to the midline is the leg area, and this area is in the olden days when we didn't know it, choose the shortest route to the tumor and goes right through the hand area and cause a paralysis of the hand. But now we can choose a smarter trajectory and avoid those areas and remove tumors more sophisticatedly. No longer do we remove tumors like this. And this is how they used to do it in the good old days. We can also do awake surgery. We can operate on patients awake. This is a patient who has a tumor in the area of the hand and leg. And while we're operating on them, we have the ability to check hand and leg function while the patient is fully awake. So we are operating on the brain while the resident doctor is checking hand and leg function to see that we are not making him any weak. If you're making him weak, we can stop removing tumor, but you are able to enhance the safety and remove such tumors. All this while he's watching his own operation on a screen in front of him, which I think is pretty fascinating. Now, the other topic that, especially for the elderly, is forgetfulness. Forgetfulness, a lot of elderly people, a lot of the times I see tons of patients with grandchildren who come with grandparents and say, "Oh, my grandpop is forgetting things. He's not behaving properly. He wanders somewhere, doesn't come back, gets lost, doesn't remember where he is, doesn't remember what he's eaten." And sometimes they're taken straight to a psychiatrist and they're given some antipsychotic medication. They're given something for anxiety. They're given something for depression. But my suggestion is, always do an MRI first, because a tumor in the frontal lobe can cause these exact same symptoms. And we just attribute it to old age all the time. Oh, this guy's getting senile, he's behaving like that. But that's not true. Tumors in the frontal lobe can cause exactly the same symptoms that all our grandparents have. So it's very important that you don't neglect it. For example, this lady was given psychiatric medication for abnormal behavior until she had a seizure, which prompted an MRI and showed a large You can see this white blob is a big tumor in the frontal lobe. We removed it and she recovered completely. The other things that one should be very aware of for symptoms of forgetfulness is vitamin B12 deficiency. So everybody should check their vitamin B12, their vitamin D3, thyroid functions. Sometimes syphilis, I mean, now is extremely rare, but a chronic subdural hematoma, elderly people sometimes bump their head here and there, don't even realize it. And over time, can develop a collection of blood in the brain very, very, very slowly over a few months. And then they start having symptoms of memory impairment. And when you ask them if they've had a fall or anything, they won't even recollect it. But in elderly, what happens is that because the brain is atrophied or shrinking, the space between the brain and the bone is quite a bit. So small blood vessels that go from the brain to the bone can snap, and blood collects over there and then pressurizes the brain. And those symptoms can lead to forgetfulness, memory impairment, and sometimes they can get progressively worse. So also collection of water in the brain in the elderly can lead to symptoms. So before you label any elderly person as having psychiatric symptoms or symptoms of dementia or memory problems, please get an MRI to make sure there's nothing structural that is causing these problems. Again, a lot of people who have headaches may have tumors in the pituitary gland. And tumors in the pituitary gland not only cause headaches, sometimes they can cause visual dysfunctions because they compress over the optic nerve. And very rarely they can cause hormonal dysfunction. If they secrete excess of pituitary hormones such as thyroid hormone or Cushing's or cortisol or growth hormone. Infertility, several times, several couples have sought treatment for infertility for a long time. And they have not done any kind of imaging of the brain when the problem is a tumor in the pituitary gland, which is responsible for the tumor. And they've taken hormonal therapy without addressing the issue in the brain. And we've removed this tumor and they've conceived the next day. I mean, not the next day, but you know what I mean. For example, now we can operate on these tumors through the nose. I mean, this is going through the nose and operating on a brain tumor. You can see this white stuff is the optic nerve. This patient had significant visual dysfunction, and this is the pituitary stalk here. And we can remove these tumors safely without opening up the head now. And we were able to restore vision of this lady completely by the time she was discharged with a simple and straightforward operation that hardly takes about 2-3 hours to do. Just because I'm saying it's simple, don't try it at home on yourself. The other very, very common symptom that the elderly should be aware of is trigeminal neuralgia. A lot of the times people have tooth pains and tooth aches and they go to a dentist, and sometimes the dentist says there's a cavity and they get a cavity done, and then they say there's a root canal and get a root canal done. They get 2 root canals done but the pain is not going, 3 root canals done but the pain is not going. An astute dentist will quickly recognize this as not being a problem with the tooth but a problem with a nerve in the brain that is being pressed by an artery. So if a dentist recognizes that, they usually refer the patient to us. But sometimes I had a patient who is having this simple problem and was advised a jaw replacement. Can you believe it? A jaw replacement for a simple problem that there's a artery in the brain behind pressing on the trigeminal nerve, which is the nerve that gives the sensations to the face, gives sensations to the jaw. And when it compresses the nerve, you get a sharp shock-like sensation down the whole distribution of the face, and patients can't eat, chew, swallow. It's sometimes called as the suicidal disease. The pain is that severe. The pain is worse than the pain of labor or an epidural. And the operation is very simple. You put a small pad between the artery and the nerve inside the brain over here, and the patients miraculously recover. So if you have that kind of pain ever, and you feel the joy of that recovery, you will realize what I'm talking about. But it's important to know when you have these symptoms, or when your friends have these symptoms, and they're saying, I've been going to a dentist and it's not helping, then one batti should go off in your head, and you should be able to say, hey, this might not be a dental problem, it might be something in the brain which needs to be looked at. So it's very important that we as the elderly are able to take care, or able to take charge of our own health. And you can see this is an actual patient of trigeminal neuralgia whose pain was like this before surgery, and look how happy he is after an operation. In the olden days, we used to perform surgery like this. The operation theater was called a theater because the surgeon performed, and everybody really looked at that performance from the windows above. But now we've really evolved in our in our management of patients, and we've got a very highly sophisticated operation theater with a robot and a navigation system and state-of-the-art equipment. We can now this patient is not my patient, but had a problem with playing a particular note, is a musician playing a particular note on the guitar, and they were able to take him to the operation theater and just stimulate that part of the brain that was responsible for playing an abnormal note, so that he could go back to playing his music again. We've now evolved at an age where we can enter the brain through the eye, through the nose, through the ear. Don't imagine any other orifice, but we can even enter the brain through the groin, like I showed you. Now, most people, I'm really sorry, I have a terrible cough that just doesn't seem to go. Most people ask me, how do we keep our aging brain healthy? How do we and the answer to that is very simple. The answer to that is so simple. It's in these 6 steps. You eat less, you exercise more, you sleep adequately, you don't stress, and you eat the right amount of food. Diet does play a very, very, very important role. Less saturated fat and more omega 3 fatty acids. So this is all good for the brain. This is all very good for the brain. If you have all kinds of berries, blueberries, red berries, if you have raisins, green leafy vegetables, if you're really fond of chocolate, then the only chocolate you should eat is dark chocolate. I mean, I can't resist eating chocolate, but I'm just saying this if you want to be proper: fish, spinach. If you're Parsi, then you can eat as many eggs as possible. I mean, when COVID was going on and food was a scarcity, this is what our fridge looked like at home. So then the other thing that really improves mental cognition and faculties is learning a second language. In India, we already speak 3-4 languages, but beyond that, if you learn another language, even at old age, if you start learning, it really gets all these. We have about 100 billion cells in our body, in our brain alone, 100 billion, and sorry, these cells form synapses and connections, and there are about 300 trillion of these synapses. And the way to increase these synapses is to stimulate the brain by doing activities that are not routine to you. So supposing doing this stuff regularly with your right hand, you should start using your left hand. Use the computer mouse with your left hand, brush your teeth with your opposite hand in the morning, and then you will realize automatically that you're becoming sharper and swifter. Again, some form of exercise of meditation, sitting mindfully for about 10-15 minutes a day, closing your eyes, focusing on your breath, helps a great deal in boosting. And now, initially, when all these guys used to talk about yoga and meditation, there was no real science to prove it. But now there is enough and more studies have shown the effect it has on the brain. They've done MRI scans on meditators. They've seen that the thickness of the cortex increases. They've seen their ability to deal with complex situations becomes better. So now you have all of these effects of meditation very, very scientifically proven. And it's very important to just keep moving. If there's one take-home message apart from the fact that you should get an MRI of the brain if you have any kind of headaches, apart from the fact that if you have a sudden onset symptoms of stroke, you should go straight to the hospital. If you have the other take-home message that I want to tell you is that you should, in any form, keep moving, stay mobile, especially the elderly. And if anyone tells you take bed rest, it's the completely wrong advice for anything. Very, very few select indications for bed rest. But keep moving. If you have children in the house, you should actually encourage them to jump around. You should encourage them to be active. You should encourage them to go out and play, because all those things have shown very, very significant improvements in the brain. And now, in the next couple of minutes, I will talk to you about the spine. And then we will take questions together for the brain and the spine. The spine is, in some sense, an extension of the brain. I'm sorry, I just can't seem to control the cough. A lot of people ask you, if you have a spine problem, who should you see? Should you see an orthopedic surgeon, or should you see a neurosurgeon? Should you see a physiotherapist? Should you see a chiropractor? Should you see a general physician? The answer to these is you could see any of the above. And it's important to see a neurosurgeon is someone who specializes with the spine on a regular basis, and they might guide you whether you need any imaging done, or you can focus on physiotherapy and what kind of physiotherapy. Orthopedic surgeons also look at spine problems. There are orthopedic surgeons who deal primarily with spinal issues and don't do any other work. So those are the kind of orthopedic surgeons you might want to see. And a good physiotherapist also may be able to help you initially with your problems, unless they are too severe. So you understand that the spine is a series of curves. There's a cervical spine, which is where the head meets the neck. Then there's the thoracic spine and the lumbar spine. And there are several of these bones that stack up one on top of the other. And in between them, there are discs. And these discs serve as shock absorbers for the spine. And when these discs degenerate, they go and pinch the nerve. You can see that this hole is where the nerve comes out from the root and goes and supplies the leg. So when this disc degenerates for whatever reason, it pops out and it pinches on the nerve, and which is why we get what we call sciatica, or pain that goes from the back down into the legs. And the primary problem, is not a problem with the disc, is not a problem with the bone, is not a problem with the joints. It's a problem of the muscles. So the key point is in actually strengthening the muscles of the back. That is the simple solution to those problems. And strengthening the muscles can only be done by exercise. Also, it is very essential that we maintain a proper posture. So when you sit, it is extremely important that you sit with your bum pushed in right into the angle of the chair. You should not be allowed to have any space. So if it's not happening, then you put some kind of a lumbar support. And ideally, your feet, your knees, and your hips should be at right angles. So that's the correct way to sit on a chair. Every time you feel like you're slouching to a chair, you should get up and push yourself back in. The other golden tip is that you should not remain seated for more than 45 minutes to an hour doing whatever you're doing. So every hour, if you have a desk job, get up, take a 5-7 minute break, take a walk, stretch a little, and then come back. The spine hates being in one. And that is why, when you suddenly sit for a long time and then get up, or you're watching TV in some really awkward position for 3-4 hours, and then you get up with a severe catch in the back. So that you must not do. You should always try and keep changing your position, especially when you're sitting. When you're sitting on your desk, you should make sure that your computer is at eye level. You're not slouching forward. You should make sure that you have an armrest, preferably where you can rest your elbows and your shoulders, and put a little bit of a footstool um, below your feet, which is about 6 inches, so that your knees are at right angles and your hips are leveled. That should be the correct way to sit on a chair, especially if you're working in the office all day. And then remember to get up every hour, stretch a little. When you're trying your shoes, don't bend forward. Bending forward directly is not a good thing for the spine, unless your muscles are toned adequately. When you're tying your shoelace, put your foot on the uh, opposite knee and bend. Similarly, when you're trying to bend to lift up something, always bend at the hip and the knee. Don't bend forward straight. As much as possible, if you're trying to bend at the hip and the knee, which is extremely important. Don't just bend forward and lift up something. So similarly, when you sleep, how you sleep also is crucial to whether you're going to have a lot of back and leg pain in the future. Now, when you're lying straight on your back, ideally you should put pillows below your knees. And if the best posture to lie is on one side, either one side, and you put a pillow between your knees when you lie. And that is really, really helpful. And most importantly is when you get out of bed. When you get out of bed in the morning, we just lunge ourselves out of bed, right? Without thinking too much. But that's not the correct way to get out of bed. You turn to one side and then you put your feet first down and then use your hands to get out of bed. You turn to one side, put your feet down first. Don't load the spine and then use your hands to get out of bed. It's very important to do it that way. That reduces the load and the wear and tear that the spine faces. Similarly, when you're getting in and out of a car, we just get in and out of the car without really worrying about anything. But the ideal way to get into a car is to sit on the seat with both your legs and then put both your legs simultaneously inside. That's not only good for the back, but it's also good for the hip and the knees. And similarly, while getting out of the car, you turn out, put both your feet down on the floor, and then use whatever support you have to get out of the car. If you are able to do these few things mindfully on a daily basis, then you will prevent significantly the wear and tear of your back. Supposing you're lifting some kind of object, don't lift the object away from the body. Lift it close to the body. It's very, very essential that you lift it close to the body. Because you know how when we go to the airport, we lift bags off the conveyor belt, and several times I get patients who've got a catch after doing that because the lever arm is very long, the fulcrum is very long. So anything heavy has to be lifted very close to the body. So low back pain. Low back pain, the mechanical kind of back pain is typically pain that is in the back and is really lying down. It may or may not radiate to the leg. A lot of people who have low back pain, have chronic back pain. Those patients but the good news is that most gets better with physiotherapy and medication in more than 95% of the cases. Patients who have chronic back pain should always do x-rays in dynamic positions. Several times patients have chronic back pain and nothing is seen on the x-ray or the MRI because those are all done in lying down position. But the pain is actually when the patient is walking or standing, and here it might be difficult for you to understand, but there's a subtle instability of the spine. One bone is moved forward compared to the other, and you can see that there's a gap in the bone over here. And there's a little bit of a disc that's bulging. And we can actually fix these things with a very, very simple, minimally invasive operation. And patients, the kind of pain relief they get is unbelievable. This, again, you can see how the spine is degenerated. Ideally, a spine should be aligned completely. Here you can see that this body has moved forward compared to this. And you can see how she's got multiple disc bulges. And even all these operations we can do minimally invasively. with stitches that are not even visible and scars that go away in a couple of. You can see this lady. This lady actually flew all the way from America. She had very severe pain, but she didn't have insurance. She went to the institute where I trained in, and they said it's going to cost you $300,000. But we know of a surgeon who's just trained with us and who can do it for you in Bombay. So she flew down to Bombay, and we did the exact same operation in less than $10,000 for her. And you can see how beautifully she's walking after surgery compared to what she was walking before surgery. She looks like she's, walking on the ramp. It almost looks like a completely changed person. With all the money she saved, she flew back business class. And this is what we did for her. We fixed her spine with screws and rods and stabilized it and relieved whatever pressure was compressing the nerves. This is another lady who had about 4 or 5 spinal operations. You can see such a big scar going all the way down, 1 foot scar on the back. But her main issue of instability was not addressed. You can see that this is all aligned, but here the spine is moved forward compared to this. There's a step deformity, and that we fixed, and she made a dramatic recovery. You can see most of these patients who come to us are in severe kind of pain. This guy was airlifted from and was sent to us, can't stand, walk, and this is a couple of hours after surgery. Not even days or months. This is within 2 or 3 hours after surgery. We make also, one must understand that all pain that comes from the lower back is not a pain that's coming from the lumbar spine itself. It can come from the sacroiliac joints also, especially women who are pregnant. Their ligaments get stretched a lot, and that pain has to be addressed in a different fashion. And that is why it's important to see a correct physiotherapist or a correct chiropractor or a correct physician or a surgeon. I give this chart of exercises to all my patients. Basic leg and back strengthening exercises if you do for 10 minutes a day. Simple exercises like tucking your tummy down into the ground, putting your knee into your chest, some kind of rolls of the spine. That will constantly maintain very good tone and help you. But what are the red flags? Like we had red flags for headaches, we have red flags for spinal pain. If you have spinal pain associated with fever, if you have pain associated with any kind of trauma, if you had a malignancy, supposing let's say you had breast cancer 20 years ago and you're cured and you have new onset back pain, you should get an MRI done because it could be a metastatic spread. If you have unexplained weight loss, a lot of patients who undergo dialysis because of the fistula that they have can develop infections of the spine. And we see that very, 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 very regularly. So it's something that has to be, you can see, this patient has an infection, you can see in this one. And now with minimally invasive techniques, we are able to cure it beautifully. But someone who comes with a bad infection, a big infection, may need a big operation with, this kind of screws and rods put into the spine. But most 80% of our cases we do minimally invasive. And the advantage of minimally invasive surgery is that there's less tissue damage, there's less pain, the blood loss is less. Post-operative stay is just 1 or 2 days. There's hardly any infection and the recovery is very good. Now, patients who have spinal cord tumors, they have pain on lying down. Patients who have degenerative back pain, they have pain on walking. So that difference one should know. And one should be, you can see a big spinal cord tumor inside the spinal cord, and then we can remove it and these patients get free of pain. And last but not the least is neck pain. Everybody, has a lot of neck pain, neck stiffness, tightness. Again, most of these problems are muscular in nature and can be dealt with some pain relief medication, physiotherapy. But it's important to make sure that you're not missing out. Supposing you have TB of the spine, you have restriction of neck movement, you have a tumor, all those things you have to get an MRI done. So if this pain is not settling down in 2 weeks, you should get an MRI to make sure there's nothing pathological going on inside. Now, most of us are on our cell phones all day long. And, staring at your phone for half an hour is equivalent to putting a 30-kilo weight on your head. So you should be very mindful of that. So if you have neck pain, but along with that, if you have tenderness means if I touch your neck and you wince in pain, that's not a good sign. If you can't move your neck in all directions, it's not a good sign. If you have pain going down into your arms, that's not a good sign. So really, I mean, we operate on only less than 10% of patients who come to us for spinal problems. But we operate on only those patients who we know will improve 100% after surgery. So it's very important that we choose the correct patient, we operate for the correct indication, do the correct surgery on the correct side. And obviously the surgeon also matters. You know, I would advise all of you to check your calcium, vitamin D3 levels, vitamin B12 levels. And if your vitamin D3 levels are less than 50, then you should take some form of vitamin D3. You can take a screenshot of this if you want. And this can, for three months every year, you should take this course for 3 months every year. And that will help a great deal in taking care of your bone health. Women after the age of 50 should always get a bone density scan to check for osteoporosis. And if you have osteoporosis, you should take the required medication. Now, what I do is I write. I mean, if you are interested in technical stuff, I write in a magazine called the Neurology India, which is India's premier neuroscience journal. And I also write in the Sunday midday every fortnight. You know, just patient stories to educate people to be able to identify symptoms on their own and to take responsibility of their own health. And it's kind of a personal experience and a personal journey to share with everybody the kind of cases that we treat. Because I mean, once upon a time, if a patient went to the operation theater and came out alive after surgery, in whatever condition, whether he was vegetative, paralyzed, surgery was considered successful. But now we're able to reverse neurological deficit, and patients are walking, talking the same day after surgery. And the advancement of neurosurgery is not neurosurgery alone, it's advancement because neuroradiology has advanced, neuroanesthesia has advanced, intensive care. So it's a very, very collaborative and a team effort. And because of that, the success rate of what we do is now close to a 99%. So I'm going to end with this, and I'm happy to take any questions that any of you will have. And if you need to get in touch with me regarding anything address, a lot of the information is also on the website. You know, if you just go into the patient info section of the website, a lot of brain and spine healthcare tips are available. So if you're happy to take a look at that, then you can do that. But to take questions if it's okay with everybody.
Okay. Thank you so much for providing us such a nice information. It will be definitely helpful. My question is, what type of exercise a myasthenia patient should take or do?
See, myasthenia patients, you should be a little careful about considering exercise on a regular basis. Myasthenia, what happens is that exercise causes fatigue. You know, has a muscular junction, and that causes fatigue of the muscles. So the more you exercise them, so unless your myasthenia is nicely firstly controlled with medication, you mustn't go into any kind of vigorous exercise, because that can precipitate a serious. My suggestion is that once your myasthenia is under control, then you can start with brisk walking or things like that. But keep it simple. Make sure the especially if you have facial weakness, then you're not trying to blow some balloons or trying to close your eyes tight open and wide open. Those kind of things might help.
And will that, like, breathing exercise should be done or no?
Breathing exercise you can do, but it's important that your myasthenia is firstly controlled properly. Then you can start with simple pranayama exercises, and don't do anything very vigorous.
And if the patient has little bit of difficulty in chewing,
Then
like
also there are
little
special,
like carrots, for example, carrots it's little difficult. Then
yeah,
should the patient go for like a cubes of carrot, or it should be grated and then eaten?
ideally grated and then steamed.
Okay,
Then
so if you have a difficulty, if a patient has a difficulty, it is advisable to make it convenient for him and not like exercise.
yes, yes,
Okay.
yes.
Thank you, doctor. I appreciate.
No, no problem. My pleasure.
Hello,
Hello.
doctor.
Hello, I'm
Hello.
Asha. Hello,
Hello.
I'm Asha Gurnani Bola. I want to know, sometimes, can you hear me, doctor?
Yes, I can hear you.
Yeah. Okay, sometimes the thigh to the leg, I had a lot of pain 2 months back. It's much better. But one doctor says it could be the nerves, one says it's the muscles. And it's not like it's the knee pain, it's just running. Sometimes when I climb the steps, it just hurts a little bit. Means
Yeah.
it's not comfortable. Now, what pain is this? I can't seem to
Yeah,
understand one.
if it's going down
Can
from
you-
the back of the thigh,
Not back, thigh,
yeah, from the back
Front
of the thigh, I'm
thigh.
saying.
okay, yeah.
It's
Actually
always,
more in the front, on the front side.
it's
Sorry.
always a combination of nerve and muscle pain. So
Okay,
the key is to do some physio and to strengthen the muscles around the thigh. And if you're getting better, then you're probably doing something right.
okay.
If it's something always get
Hello, doctor. Hello. Hello.
One minute, let him finish. Yeah.
Hello.
Yeah.
Hello, doctor. Can you hear me?
Yes, I can.
Doctor, can you hear me?
Yes, I can.
Yeah, you can.
So I wanted to ask whether there is any assessment on these things like brain. After certain years, can you assess all these things instead of going to doctor after symptoms?
So you
What
can,
is the
the
facility?
recommendation is not to get an MRI unless you have symptoms. But if you,
Okay.
because
Yeah.
no one would suggest you to do
Yes.
for it. But you can always get an
Yes.
MRI brain as a standard thing to check if there's anything major going on.
Yes, sir. Yes, sir. Thank you very much, doctor. It was a wonderful lecture by you. Enjoyed like anything. I want to meet you one day. Thank you very
Oh,
much,
it
sir.
would be my pleasure.
Bye bye. Bye bye. Bye bye.
I have to.
You're on mute, madam.
Okay. I have two more questions.
Yes, madam.
One is, can you do any exercise for forgetfulness? Like old age, you forget a lot of things. So that is one question. And the other question is, if a person's autoimmune test, like LEG or ELG or something, some exercise, some test that comes to on the borderline, is there anything to take precaution?
So for forgetfulness, it's important that you keep your mind active. You can solve crosswords, you can do some Sudoku, you can read, there are several things that you can do to keep your mind and body active. Go for a brisk walk every single day. That is both very good for physical and mental health. And what was the second question?
If like there was a test to check the autoimmune of your body, how it works, and if it comes on like autoimmune is on borderline, is there any precautions to be taken?
No, so the autoimmune tests are not very specific, and a lot of people have ANA positive and all those things without really having anything specifically wrong with them. So if you have very specific symptoms, your treatment should be targeted towards that rather than worrying about, just a just an overall autoimmune condition, because there are hundreds of autoimmune conditions that exist in the human body.
I know. See, in my family, 5 people have autoimmune problems, like different problems.
Yes.
Mine is on borderline. I don't have any problem. Only thing I forget
Yes.
too much. But other than that, nothing. So should I be cautious about anything?
No, I think you should just remain active.
Okay. The more active I will be, it will be all right.
Yes.
Okay. Thank you so much. That helped. And where is your clinic? Like, where is your consultant?
I'm at Wokhard Hospital, Bombay Central.
Wokhard. Okay. Thank you.
Great. Anyone has any other questions? If not, then we can
Yep.
wind up.
Yeah, Sakshi? Hello. Yeah. I want to thank you a lot, Doctor. It's been a lovely session because there were so many things that even I was not aware of, which you've clarified. And hope you come to us again and you write for us and do things for graceful living. Yeah. Yes, Doc?
It will be my pleasure. I'd love to
Can you-
spend time with Lily, my favorite group of people.
Yeah. So, no, your voice is breaking, so I couldn't hear that. But we from Graceful Living are very happy to have had you. Yeah. Thank you very much.
Thank you so much.
Thank you.